Where is Addison George? Addison. In Illinois, she had the guts to take on Governor Pritzker and these mandates that are hurting her ability and all of her classmates' ability to learn. She actually stood up. She's been featured on Tucker Carlson and other national shows because people are looking for others that have courage, and especially from our youth, because it's your generation that's the most affected. Millions of kids that aren't getting the learning opportunities that they deserve. I want to hear from Addison. Tell us your story, Addison. Come on up. Yeah.
Okay. So I have been doing remote, well, not been doing remote.
Come on up here so the cameras can see you. Come and turn around.
Come on over here.
Okay, I had to do remote school for over a year, where I was sitting in my room alone at my desk, staring at a computer screen, not retaining any information. I couldn't talk to any of my friends for over a year. And then finally, we were able to go 2 to 3 days a week. My classes had about 6 to 7 people in it. We all had our faces covered, all facing forward, not really allowed to even talk to our friends, 6 feet apart. Like, it was not school. I had everything taken away from me that made high school high school. I couldn't go to dances. My sports were shut down. So I for over a year, I didn't get the high school experience. And then during the summer, the mask mandate was lifted. I could live my life again. And then suddenly, when school started, we were able to go 5 days a week, but now suddenly we had a mask again, even though we didn't during the summer. So we were back to social distancing, wearing a mask, and again, my high school experience was taken away from me. And finally, people in my community got fed up, and they sued for the right to not have to wear a mask. And so now, at least for now, we don't have to wear masks in school, but it took way too long to get there. And so there's studies and data from a lot of states showing that school closures, lockdowns, and masking kids were ineffective strategies to fighting COVID. And the harms of these measures have been immense, especially for kids. But elected officials in my state of Illinois don't seem to care at all. My governor just said on Friday that despite the lawsuit, he still has the right to mask kids whenever he wants. So my question is, how can leaders like you at the federal level work to protect the rights of the individual to ensure that parents are able to make the best decisions involving their kids' education?
Well, first, let's applaud Addison for her courage.
Great job.
And, you know, we've been having hearings on this, and one of the leaders here in Congress is not only a doctor. By the way, if you ever wonder if your vote counts, she got elected to Congress in maybe the closest margin in the history of America. 6 votes out of about 400,000. 6 votes made her a member of Congress, and boy, is she making all 6 of those votes count. She has been a phenomenal leader, but she was the public health director of the state of Iowa. And so she speaks with real command because she cares about public health and medical science, not political science, which you experience in Illinois. With that, Mariannette Miller-Meeks, tell us what you've been working on.
Thank you so much. And Addison, I just want to commend you. Your parents must be so proud of their daughter and raising a daughter that would be vocal and look at what you're supposed to do in school. You know, have a hypothesis, want to research it, look into the research, get the data, and then come up with a position. Unfortunately, that's not what all elected leaders to do. And let me also say, there's a little bridge that was just reopened, the I-74 bridge, that'll bring you right into Iowa, and we would be happy to have you there. Because let me contrast a little bit for you. In Iowa, just across the Mississippi River from you, our governor, Governor Reynolds, when I was a state senator in 2020, we looked at this issue, and we looked at it very diligently and what we were going to do with schools. And I remember sending to all of my colleagues in the state legislature a paper by the American Journal of Pediatrics talking about the low level of transmission to almost no transmission of children for COVID-19. So we decided in Iowa to reopen our schools in the fall of 2020. Reopened schools, and then the next step was we are not going to allow mandating of children wearing masks in schools. So why would that policy exist? Safety of students, safety of teachers, and the effect it has on learning. And to each of those, there is a risk and benefit of action and inaction. And as you've already explicitly said, what does the science tell us for safety of children? Almost no transmission, especially in the elementary school. Kids don't get sick, even up to high school. So what's the effect on children of masking and social distancing and locking down schools or preventing them? There's no upside. It's all downside. What's the downside? So in order to keep kids safe from COVID-19, of which most of them don't get sick, very few die, the parents can decide what their risk factor is and if, in fact, they need to mask or they need to social distance or not even go to school and learn virtually. What's the downside? The downside is horrific. And the fact that we have allowed that to happen in the United States and continue to happen in the United States is unconscionable. The downside, loss of learning. We knew just over the 2 months going into the summer of 2020 that there was almost 6 months of loss of learning. And not only that, minority students, low income, those that are most disadvantaged had the greatest loss of learning. So much so that the World Health Organization said that childhood poverty has increased by 15% and will be decades until we're able to reverse that. What other downside? Not only loss of learning. The Las Vegas school system opened up last year, and I mentioned this in our Education and Labor and in our Select Coronavirus Task Force. Why did they open their schools? Because in 2020, between March 16th and June 30th, 6 students had committed suicide, and between July 1st and December 31st, 12 more students committed suicide, the youngest of whom was 9. That's tragic for us as parents, but I can't even imagine how you are in a school system knowing that you have peers who have suicidal thoughts because of depression, anxiety, and we've already heard that there are more people who have died, young people, 18 to 45, who are not at the age group at risk for dying of COVID or getting seriously ill from drug overdoses and addiction. So the risk to students is tremendous on the downside. What about the safety of teachers? Can they mask? Certainly. Can they socially distance? Absolutely. Can they have a plexiglass cinder? Yes. Didn't we increase and put them at the top of the line for vaccinations? We absolutely did. And yet, do we still have school systems that are closed? Yes, we do. We look at what the CDC did in cherry-picking data from a bad study to show that masks were effective when, in fact, the study showed exactly the opposite. Let me just say this unequivocally. There is no scientific data for those Democratic governors right now that are removing masks from adults to still require masks in school. That mandate should have been gone yesterday. There is no scientific data to support unmasking adults, but forcing children to remain masked. So we can protect the safety of students, we can protect the safety of adults and teachers, and then get back to teaching children and letting them learn and have a normal socialization, normal life, because indeed, you're our future. And we have not done a good job of protecting your future to protect ours.
Well, thanks for your leadership.
Good answer.